Well, good morning, everyone, and thanks very much for the invite, Cindy. It's been great getting to know you and the team. Let me start off by saying, I've learned more and more about UHN over the number of years. My family's in healthcare. My wife actually is a nurse at Credit Valley Hospital, which is part of Trillium, and I really appreciate all the great work that you do. And a lot of it is done with the generous support of many of you in the room, so thank you and the community. Really, I'm going to summarize my presentation in about 30 seconds. Okay, so I'm going to have some stats and they'll support the comments here, but really it's 30 seconds that you need to capture, and it won't come as much as a surprise. One, there's an aging population. This aging population is living longer. As we live longer, we have more probability of having chronic conditions. Chronic conditions cost money and require treatment. So these individuals require more support of the system. Okay, so aging population that's living longer, that has a higher probability of a chronic condition, which is going to put more strain on an already strained system. So that would be the overarching theme of today to set the stage. So as Cindy touched on, there's some really great stats that are out there that support my statements. So first of all, if you're not aware, over 1,500 Canadians will turn 65 each day. By 2036, we're going to see 1 in 4 Canadians will be over the age of 65. And the life expectancy, as I mentioned, continues to be extended. So the life expectancy in Canada right now is 82 years old. If you reflect even just 2, 3, 4, 10 years ago, that was a significantly different number. 10 or 20 years ago, the number would have been at about 78.6. So just over X number of years, you can see that life expectancy is extending, which is great. Oh, sorry, the other thing I wanted to call out here is that over the next 20 years, as expected, the Canadian senior population is expected to grow significantly, by 68%, right? So it's a little difficult to see, but I'll just call out some information here. If you look at, seniors 65 and older in 1977, it was 2 million Canadians. By 1997, it was up to 3.5 million Canadians. 2017, we're up to 6.2. 2037, expected to be over 10 million Canadians, so a quarter of the population. So again, we have this aging population that continues to grow. So as we reflect on the impacts to Canada, I touched on the impact to healthcare, right? So we expect that by 2030, over 40% of the individuals, of our seniors, will a 40% increase in cancer cases, right? So as we get older, higher probability of having cancer, unfortunately. We have dementia. We're expected to see 66% increase over the next 15 years. And again, that's not that dementia is necessarily increasing, it's more of that the population is shifting into the seniors where you see that's a higher prevalence. By 2041, seniors will have the highest rate of mental health. So again, I work at Sun Life Financial. We have what's called a disability plan. So for employers that have employees that provide disability benefits, what we see there is 1/3 of all of our claims or more is actually related to mental health, which is surprising. It's just been increasing dramatically over the years. So that's an area of focus for Sun Life and many others. And then the last one I wanted to call out was that 75 to 80% of seniors report having more than one chronic condition, right? So what you'll see on the next slide here is, based on age groups, right? So you look age group less than 20, this is prevalence of chronic conditions. Age group less than 20, obviously the birth of a child, there's quite a cost associated with it. And there's some chronic conditions that come with it. But between the ages of 35 to 49, you can kind of get a sense, right? So you look at cancer, you look at COPD, you look at cardiovascular, you look at hypertension. Like look at hypertension alone when you're in the age group of 35 to 49 versus when you get into the senior, right? So it's almost 4.5 times the size, right? So the point, back to my earlier comment, was we have an aging population. As the population ages, we have a higher prevalence of chronic disease. That results in more pressure on the healthcare system, and I think we're going to be talking more about that as part of the panel. Another interesting stat here, so what's the financial impact? So first of all, healthcare spending on seniors is 4.5 times greater than the ages between 15 and 64. right? So as we get older, more chronic conditions, obviously it requires more of an investment in the individuals. We also see that even though the senior population today is about 17%, the hospital cases represent 34%, so the seniors represent 34% of all hospital cases. In addition, if you look at the days in the hospital, 58% come from seniors. Prescription drugs, another hot topic that's out there these days. So prescription drugs, approximately 40% of the prescription drug spend in Canada goes towards seniors. So again, aging population, one with chronic conditions that require prescription drugs to be able to address the chronic conditions. So I always say there's no place like home, and a lot of the discussion today that we're going to get into with the panel is about helping individuals stay at home, remain healthy, what technology is out there to be able to support that. So we're going to have a lot of discussion about that. But a couple stats that I just wanted to share. Nearly 2/3 of seniors living in long-term facilities take actually over 10 drugs or more, right? So that's to treat all the various chronic conditions that they're on. The other one, just the last bullet very quickly, so 2.4 million Canadians 65 years or older will need continuing care by 2026, which is a 71% increase. So again, as we have this aging population, there's more and more demand for these types of environments. So that is intended, we're going to get into more discussion, happy to discuss some more stats, but that's really intended just to give you a snapshot into what's going on out there from a demographic perspective. And I just close by saying, we have an aging population that's living longer, which is goodness. Living longer, there tends to be, with the seniors population, there tends to be chronic conditions. Chronic conditions continue to put significant pressure on the healthcare system. I know we're going to talk about some solutions shortly. Some of the solutions I'd like to get into will be about technology. So last week I was fortunate enough, we went down to Silicon Valley, and we tend to spend a fair amount of time down there working with startups. If you're not familiar, there's many organizations, in Toronto as well as in Silicon Valley, that are what they call startup accelerators. Basically what they do is they work with startups that have a great idea, that are looking to bring their idea to fruition, bring it to market. So when we were down in Silicon Valley, we had a bunch of different discussions. We met with over 30 startups in a short period of time. And I can tell you, the majority of startups are focusing on healthcare. And it's fascinating, the stuff they're coming up with. We'll talk more in the dialogue, but just some examples out there, like there's devices out there today that can monitor your ECG, capture that information, and send it to your physician on a real-time basis. Or if you think of Alzheimer's, right? You've seen things like Fitbits and those types of devices. There are other devices out there today that are used for individuals that are suffering from Alzheimer's to be able to track where they are, right? So whether it's a Fitbit or something different, and when I say something different, you'll see a trend in the years to come where devices like Fitbits will start to disappear. And what I mean by that is these devices will start being embedded into your clothing. Right? They'll be embedded into your typical watch, right? So if you think of someone suffering from Alzheimer's, or you think of the individuals that are supporting the individual that's struggling from Alzheimer's, what a great relief to be able to know where that individual is at all times. So there's one application out there as an example that will tell you when so let's say my father is suffering from Alzheimer's. I could put a boundary within our house, our home, say a 3-kilometer radius. And what would happen is if my father went beyond that 3-kilometer radius, I'd actually get notified. So there's a bunch of, we'll talk more about the technology that's out there, but there's some fascinating technology out there that not only helps the individual that's suffering from the chronic disease, but also really helps the people that are actually helping support them, the caregivers. So with that said, I'm going to turn over to Dr. Samir, who is going to continue the discussion.